You're about to hear what many doctors genuinely think about older patients. The things discussed quietly in hallways but rarely said directly. I've been in those rooms, I've read the notes, and what I learned was deeply concerning. Behind polite greetings and professional behavior, there's a less visible reality influencing how seniors are treated every day. And it goes far beyond medical knowledge. It's shaped by time pressure, financial incentives, and bias within a massive healthcare system. I've seen older adults rushed through appointments labeled as too complex, non-compliant, or in some cases, simply not worth the time. What's worse is that research backs this up. Studies show seniors receive fewer life-saving procedures, are offered advanced treatments less frequently, and are more likely to be dismissed when symptoms don't match textbook examples. This isn't speculation. It's documented evidence hiding in plain sight. Tonight, I'm breaking down 5 uncomfortable truths many doctors believe about seniors. Some may surprise you, others may feel familiar. But when we reach number 2, you'll see clear proof that older adults in emergencies often receive different care that can influence survival. Every study I mention is linked in the description. Don't take my word for it. Verify the research yourself. Before we begin, a quick question. How old are you and where are you watching from? Leave it in the comments. I read them personally, and your stories help shape these videos. Now, let's get started with truth number 5, a belief that quietly influences nearly every medical visit. Truth number 5. Seniors are seen as too complicated. Doctors are trained to make quick decisions and move efficiently from patient to patient. But older adults often arrive with several conditions at once: high blood pressure, diabetes, joint pain, cognitive issues, and more. Instead of viewing this as a normal part of aging that requires thoughtful care, many physicians quietly think, "This is too complicated." Research supports this mindset. A 2018 study in the Journal of General Internal Medicine surveyed 500 doctors, and nearly 60% admitted feeling frustrated or overwhelmed when treating seniors with multiple health problems. That frustration affects behavior. Instead of thorough evaluation, many default to quick solutions, another prescription, another referral, or a statement implying nothing further can be done. This approach is known as therapeutic nihilism, the belief that treatment won't make much difference. For older adults, it often feels like being overlooked. Take Harold, 74. He visited his doctor with chest pressure and exhaustion. He was told it was stress and advised to rest. Weeks later, another physician found severe artery blockages that could have been fatal. The first doctor saw an older patient with several issues and assumed aggressive treatment wasn't necessary. That assumption nearly cost Harold his life. The truth is, aging naturally brings complexity. Body systems overlap, medications interact, and symptoms can appear differently. But instead of addressing this complexity, many doctors take shortcuts. They skip advanced testing, avoid beneficial but riskier treatments, or rely on safe medications that don't fully address the problem. Over time, these decisions lead to poorer outcomes, more hospital stays, and a decline that could have been slowed or even prevented. The numbers are stark. According to a 2020 Age and Aging report, seniors with 3 or more chronic conditions are twice as likely to have symptoms misdiagnosed or dismissed compared to middle-aged adults. In other words, the patients who require the most careful evaluation often receive the least. The difficult truth is this: to some doctors, a senior is not a medical challenge worth solving, but a case too complex to invest time in. This mindset fuels avoidable mistakes, unnecessary hospitalizations, and premature decline. And if being labeled too complex feels discouraging, the next belief is even more damaging. Truth number 4. Doctors assume many seniors won't follow treatment plans. Here's a statistic that surprises most people. Over 50% of older adults do not take medications as prescribed. That comes from the American Journal of Geriatric Pharmacotherapy. Doctors know this, and it influences their decisions. Instead of expecting adherence, many quietly expect the opposite. They write prescriptions but assume they won't be completed. They recommend lifestyle changes but anticipate they'll be forgotten or ignored. This mindset lowers the quality of care seniors receive. Medication adherence, simply taking medicines as directed, becomes more challenging with age. Pills accumulate, side effects interact, memory changes occur, and costs can be overwhelming. From a doctor's perspective, it can feel like offering advice that won't be followed. When physicians assume a patient won't stick to a plan, they sometimes avoid advanced treatments, choose less effective options, or skip important discussions. The attitude becomes, why go deeper if the patient won't follow through? Dorothy, 68, was prescribed blood pressure medication after a hospital visit. She stopped taking it because it caused dizziness, but she didn't tell her doctor at her follow-up, fearing judgment. The doctor assumed the medicine wasn't working and doubled the dose. Days later, Dorothy fainted at home and ended up back in the hospital. Her doctor wasn't careless. He was operating under a common assumption. Seniors often don't follow treatment instructions. In the ER, her doctor assumed she wouldn't stick to her prescriptions, and her silence only made things worse. Physiologically, skipping medications has predictable risks. Missing blood pressure pills can trigger sudden spikes. Ignoring diabetes medication can cause dangerous sugar fluctuations that harm nerves and blood vessels. Forgetting blood thinners can be the difference between a stable day and a life-threatening clot. Yet instead of addressing the issue with understanding, many physicians become jaded. That cynicism forms a barrier between seniors and the care they need. Research supports this. A 2019 study in JAMA Internal Medicine found that older adults who admitted to not following prescriptions were 70% more likely to be labeled non-cooperative or difficult in their medical records. That label then shaped how intensely doctors treated them later on. In short, once you're seen as someone who doesn't follow instructions, the quality of your care can drop permanently. The real problem isn't simply that seniors struggle with medications. It's that some doctors expect it and lower their standards instead of helping patients succeed. That quiet bias can have real consequences. And if you think being viewed as non-compliant is bad, it gets worse when doctors start acting as if seniors' pain is less important. Before we continue, tap the like button and subscribe. The most eye-opening part is still ahead. Truth number 3. Doctors believe seniors hide too many symptoms. Picture a 70-year-old woman stepping into the clinic, smiling politely and saying she feels mostly fine. What she doesn't say, nighttime chest pressure, tingling in her hands, or dizzy spells that frighten her. Doctors see this pattern often, leading many to a blunt belief. Older adults keep too much to themselves. Instead of viewing seniors as clear communicators, some see them as puzzles missing essential pieces. Research supports this perception. A 2021 study in the Journal of the American Geriatric Society found that nearly 45% of older patients admitted they withheld symptoms due to fear, embarrassment, or not wanting to be a burden. Doctors know this, and it alters how they interpret every visit. They stop fully trusting the conversation and assume more is hidden beneath the surface. When suspicion replaces trust, care becomes less personal. George, 73, sometimes felt short of breath, but never told his doctor. "I don't want to waste his time," he told his daughter. After collapsing while walking the dog, the ER diagnosed severe heart failure. His silence wasn't neglect, it was fear of being dismissed. But to the doctor, it reinforced a stereotype. Another older patient hiding symptoms until it's too late. Physiologically, hidden symptoms matter more in later years because the body has less ability to compensate. Not mentioning blurry vision could be the first sign of diabetes. Avoiding discussion about bathroom issues might be an early warning of prostate problems. Ignoring numbness in the toes might signal circulation issues approaching amputation risk. When seniors don't share, doctors don't act. And when doctors assume seniors always conceal symptoms, they may ask fewer questions, investigate less thoroughly, and miss early treatment opportunities. Numbers show the outcome. Seniors who underreport symptoms have a 36% higher chance of hospitalization within a year, according to a 2020 Health Services research report. Meaning, what's left unsaid in the doctor's office often leads directly to the hospital bed. The uncomfortable truth is that many doctors believe seniors hide too much, and instead of responding with patience, Some respond with frustration, leading to rushed visits, fewer follow-up questions, and missed diagnoses. And if being viewed as secretive sounds troubling, the next truth is even colder. Some doctors think seniors don't value their own lives as strongly anymore. Truth number 2. Doctors worry about time, and seniors require the longest visits. In the United States, the average primary care appointment lasts just 18 minutes, according to the Journal of General Internal Medicine. That includes medical history, questions, examination, prescriptions, and goodbye. For older adults who often manage several conditions, take multiple medications, and have memory concerns, 18 minutes rarely works. Doctors know this, and many quietly resent it. They see senior appointments as time-intensive, and in a system where time equals money, that pressure influences the tone of the visit. In practice, the challenges are clear. Older patients speak more slowly, recall symptoms in pieces, and often need extra clarification. Many bring detailed medication lists, or even whole bags of pill bottles. A rushed doctor sees the clock ticking and speeds up, cutting off explanations, hurrying through assessments, or skipping preventive care entirely. 76, Mildred, came in with swollen ankles and shortness of breath. She tried to explain her habits and medications, but she was interrupted twice and sent home with a water pill. 2 months later, she was hospitalized with advanced heart failure. The rushed appointment missed critical details, and time pressure turned her health into a casualty of the system. Physiologically, seniors require more time because symptoms overlap. Chest discomfort might signal heart disease, but it could also stem from lung scarring or acid reflux. Fatigue could reflect thyroid issues, anemia, or medication side effects. Sorting through these possibilities requires patience. Without it, doctors rely on quick fixes that overlook deeper problems. Numbers reinforce this. Seniors seen in shorter visits experience a 25% higher rate of misdiagnosis, according to a 2019 study in BMJ Quality and Safety. Yet, in the fast-paced environment of modern healthcare, Dorothy, 68, was prescribed blood pressure medication after a hospital visit. She stopped taking it because it caused dizziness, but she didn't tell her doctor at her follow-up, fearing judgment. The doctor assumed the medicine wasn't working and doubled the dose. Days later, Dorothy fainted at home and ended up back in the hospital. Her doctor wasn't careless. He was operating under a common assumption. Seniors often don't follow treatment instructions. Longer visits have become rare privileges. Here's the uncomfortable truth. Many doctors focus more on keeping their schedules moving than on truly understanding the lives of their older patients. And when time is tight, it's often the senior patient who ends up paying the price. But as difficult as that is, the most unsettling reality is still ahead. The number one truth reveals exactly how doctors decide who receives immediate help during life or death emergencies. Truth number 1. Doctors know that age bias exists. This is the harshest truth of all. Age bias in healthcare isn't speculation. It's proven, it's documented, and it can be deadly. The polite term is ageism, but stripped down, it means doctors approach older patients differently than younger ones, even when the symptoms match. The evidence is alarming. A 2020 study in The Lancet reviewed emergency care for seniors and found that patients over 70 with chest pain were 22% less likely to receive critical interventions, such as stents, compared to middle-aged adults with the same symptoms. Another study in JAMA found that seniors facing aggressive cancers were 37% less likely to be offered clinical trials, shutting them out from treatments that might prolong their lives. The science is clear. Age bias is active inside hospitals. Elmer, 79, arrived at the ER after fainting. The first thing noted was her age. Instead of being sent for advanced imaging, she was given fluids and discharged. Weeks later, she collapsed again, this time from a massive stroke caused by untreated carotid artery disease. Her family felt betrayed. The hospital saw her as another elderly patient whose decline seemed expected. Physiologically, age doesn't reduce the effectiveness of treatment. A stent opens an artery at 75. A clot-busting drug works at 80. Radiation targets cancer at 85. But age bias leads to hesitation, delays, and dismissal, as if more years lived means a life less worth saving. This quiet discrimination means seniors enter hospitals already fighting an unseen battle long before a diagnosis even begins. Many doctors recognize this bias, and some acknowledge it influences their choices. It's the hidden calculation of resources versus benefit, disguised under terms like quality of life or risk of complications. Behind the wording sits a darker assumption, that an older life holds less value, and that is why seniors must stay aware, because knowing the truth gives you leverage. Age bias is real, but it should not dictate your outcomes. Now you understand what few are willing to admit openly, the unspoken attitudes that shape how seniors are treated. These 5 difficult truths are not rumors. They're evidence-based. They affect millions every day. Seniors are viewed as too complex, as if having decades of medical history is a complication rather than a guide for better care. They're called non-compliant the moment they struggle with medications, without doctors considering high costs, side effects, or the difficulty of managing multiple prescriptions. They're accused of hiding symptoms, when in reality, most are simply worried they won't be taken seriously. They're rushed through appointments because time is limited, even though older bodies require more explanation, more questions, and more listening. And worst of all, they face the sharp reality of age bias, where life-saving choices can shift based solely on birth year. Think about that. An older man with chest pain might get fluids instead of a stent. A woman with cancer might be excluded from trials that could extend her life. A senior fainting from a blocked artery might be sent home while the true issue is overlooked. Age bias isn't theoretical. It affects who gets treated and who does not. It influences who survives and who doesn't. And it's happening daily in a healthcare system that promises to do no harm. But here's the other side. Awareness gives you power. When you understand these biases, you show up differently at appointments. You ask more direct questions. You bring records, notes, and even someone with you if needed. You refuse to be dismissed. You insist on the same attention and urgency that younger patients receive automatically. Because one fact is undeniable. Treatments do not stop working at 60, 70, or 80. What changes is the system's willingness to offer them. And that is where you push back. Every senior watching this deserves respect, clear answers, and high-quality care. Your age should inspire more effort from doctors, not less. But that only happens when you stay vocal and informed. So here's my request to you. Share your experience in the comments. What has been your most frustrating or eye-opening moment with a doctor after turning 60? I read every comment because your stories matter. And the more we speak up, the harder it becomes for the system to ignore these issues. If this message resonated with you, hit the like button so more seniors can see it while it still matters. And subscribe, because we're not finished exposing what seniors need to know about their health past 60. Information that could truly protect your life. You deserve clarity. You deserve respect. And you deserve to live every year ahead with strength and confidence. Never let anyone, including a doctor, convince you otherwise. If you've gone through this or have advice to share, leave it below. Thanks for watching. Dorothy, 68, was prescribed blood pressure medication after a hospital visit. She stopped taking it because it caused dizziness, but she didn't tell her doctor at her follow-up, fearing judgment. The doctor assumed the medicine wasn't working and doubled the dose. Days later, Dorothy fainted at home and ended up back in the hospital. Her doctor wasn't careless. He was operating under a common assumption. Seniors often don't follow treatment instructions.